Good afternoon, folks. Now I have discussion B for you. We are discussing the future of long-term care nursing. Okay, so that is what the discussion is for this afternoon's B. I've done a essay for y'all, so I'm going to read it for you. The future nursing skills for long-term care must combine advanced geriatric clinical judgment, digital and AI fluency, population focused care, coordination, and leadership in systems and workforces, resilience, so facilities can deliver safer, more person centered care as acuity and complexity rise. Course summary: long-term care nurses will need advanced assessment and chronic disease management, telehealth and informatics skills, social detriments and care navigation expertise, trauma informed and culturally humble communication, and system level leadership for quality and give me 1 second. Workforce sustainability. Key skills, key skill domains, what to teach and measure, clinical and geriatric expertise, advanced assessment, polypharmacy management, and early warning recognition for 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 frail residents and multi-morbidity, dementia competent care, behavioral symptom management, including non-pharmacological strategies, digital data, and virtual care. Telehealth delivery, remote monitoring, interpretation, and basic AI literacy, so nurses can act on predictive alerts and integrate device data into care plans, documentation optimization, and informatics to reduce burden and improve hands-off TLC nursing, population health, and SDOH navigation, screening for social detriments, care coordinating with community services, and preventative care planning to reduce avoidable hospital transfers, relational and behavioral skills. Trauma-informed communication, cultural humility, motivational coaching, and family negotiation skills that preserve dignity and reduce conflict in high stress settings. Systems leadership and resilience, quality improvement, root cause analysis for transfers, staffing models, and policy advocacy so nurses can redesign workflows and influence facility and regional policy. Implementation roadmap, practical steps, curriculum. Add 300 hours of LTC specific advanced competencies. Clinical informatics leadership, on the job training, micro crediting for telehealth, AI alert triage, and dementia team redesign, embedded advanced practice nurses or extended competency RNs to reduce transfers and mentor staff. Trade-offs, risks, trade-offs, and mitigation. Risk. Technology without training increases alarm fatigue and documentation burden. Mitigation. Phased rollouts, clinician co-design, and protected training time. Risks. Upskilling without role design can worsen turnover. Mitigation. Pair competency development with career ladders, staffing model changes, and compensation alignment. Final note, actionable. Prioritize dementia and complex care, clinical training, telehealth informatics, micro credentials, and leadership development tied to staffing and QI matrix. These investments reduce avoidable transfers, improve resident quality of life, and stabilize the LTC workforce. Below is a full legislative hearing testimony on long-term care nursing compliance competencies crafted in your voice as a Pennsylvania health system and executive. It is narrative rich, operationally grounded, and structured for delivery before a House or Senate Health Committee. Long-term care nursing competencies. My name is Felicia, and I serve as a healthcare for geriatric care. Health system executive in Northwest Pennsylvania. I am here because long-term care nursing is at a crossroads, one that will determine whether our state can meet the needs of an aging population with dignity, safety, and compassion. Long-term care nurses are the clinicians who stand closest to our elders. They are the ones who notice the subtle change in a resident's gait, the early signs of delirium, the quiet withdrawal that signals depression, or the medication interaction that could become a crisis. But the reality is this: the complexity of today's long-term care environment has outpaced the training and competencies we currently expect of the workforce. The challenge we face: residents entering long-term care today are older, sicker, and living with more chronic conditions than ever before. Many arrive with advanced dementia, multiple comorbidities, and medication lists that would challenge even the most seasoned clinician. At the same time, facilities are operating with chronic staffing shortages, rising regulatory pressure, and increasing expectations for quality and transparency. This is not a failure of effort. It is a failure of alignment between what long-term care nurses are asked to do and what they have been prepared to do. The competencies Pennsylvania must prioritize to stabilize the workforce and improve resident outcomes. We need a modernized competency framework built around 5 core domains. 1. Advanced geriatric clinical judgment. LTC nurses must be trained to recognize early warning signs of decline, manage polypharmacy, and interpret behavioral symptoms in residents with dementia. These skills prevent avoidable hospital transfers. and protect residents from unnecessary suffering. 2. Digital and telehealth, and AI fluency. Technology is not part of the bedside. Nurses must know how to interpret remote monitoring data, facilitate telehealth visits, and use predictive analysis to anticipate risk. Without training, technology becomes noise. Without training, it becomes a prevention. SDOH, informed care coordination. Long-term care does not exist in isolation. Nurses must be able to identify social needs, transportation, food insecurity, caregiver strain, and coordinate with community partners to support safe transitions and reduce emergency department use. Dementia competent, trauma informed communication, non pharmacological behavioral management, cultural humanity, and conflict de escalation are essential competencies. These skills reduce antipsychotic use, prevent injuries, and improve quality of life for residents and families. Quality, safety, systems leadership. Long-term care nurses must be equipped to lead incentives, conduct root cause analysis, and prepare for regulatory surveys. When nurses understand the system, they can improve the, the system. Policy actions to support these competencies, to make these competencies real, not inspirational. We need targeted policy support. Establish a statewide LTC nursing home or nursing competency standard aligned with these domains. Fund micro credentials and career ladders in dementia care, telehealth, geriatric assessment, and QI leadership. Incentivize adoption of telehealth and remote monitoring paired with nurse training. Support on-site clinical mentorship models, including advanced practice nurses who coach staff in real time. Integrate SDOH screening and community partnerships into regulatory expectations. These are not abstract investments. They directly reduce hospital transfers, improve survey outcomes, and stabilize the workforce. Outcomes that matter to residents, families, and taxpayers. Members of the committee, long-term care nurses are doing heroic work in a system that has not kept pace with the demands placed upon them. If we want safer facilities, better outcomes, and a more stable workforce, we must invest in the competencies that modern long-term care requires. This is not just a workforce strategy, it's a quality of life strategy for every older adult in Pennsylvania. Okay, guys, that is your that is your B for this afternoon.